So, MN669, Unit 3 Journal. So, describe a significant event patient interaction you have experienced anytime in your nursing career up into this week. Discuss the impact this had on you in terms of increasing your understanding of the psychiatric mental health nurse practitioner role, the patient provider patient relationship, explore personal strengths and limitations and their effect on the provider and patient relationship, including reflection on your therapeutic use of self. Your discussion should reflect your specific learning insights. Identify something specific that you have learned from reflecting on this event interaction and how to help you, how you will apply it in future practice. So, all right. So, an interaction I want to talk about is in the work field, working in a psychiatric, in a mental health, at the mental health hospital. I can't dance right now at the mental health hospital. So, I've learned that sometimes when a patient is talking or venting, you have to be careful when responding, trying to further the conversation if they don't ask you a question. So, my situation, a patient, she was venting, talking about she was from California. She came here because I don't know why she came here, but she ended up in Michigan, and she went to her mom's house because her and her boyfriend was having some issues. And instead of her mom helping, she went and called the police on her. And so she ended up going to jail. Now, in the report, it stated like she was calling her mom constantly. Her mom opened the door. She was butt naked. She sat on her mom's couch butt naked. Then next thing, and she was responding to internal stimuli. And she was she went in the bathroom and she was sitting on the bathroom floor screaming, thank you, Jesus, and things of that nature. And so she was saying that she went to her mom's house to get some help. Her mom made all these lies up on her, and that's why she ended up there. And I'm just listening to her, and I'm just speaking, trying to engage in a conversation, let her know that I'm listening to her. I've learned and the way to let a patient know that you hear what they're saying is repeat what they're saying. Oh, I hear you saying that you came here to Michigan, you went to your mom's home for help, and instead of your mom helping you, she called the police on you, and that's what you weren't expecting. That's the proper way to respond as far as a patient provider relationship. Me, my big dumb self, not knowing, I'm like, girl, so what brings you here to Michigan? You from sunny California? Oh, what the F you mean? This was the response I got from the patient. Oh, what the F you mean? What I'm doing here? Cause I want to be here. I can't be in Michigan. I came here because I want to be here. What the F you mean? She talking like I can't be here, whatever. The same reason you here. It turned into a whole situation. I was all types of B's. She was African American with a blonde wig that was lifting up, and she had black hair under it. But I was all types of, excuse my language, nigger, B's. I was just, she hated me. And what I learned from that is I have to keep it professional. Like I said, respond in a therapeutic way. I forgot. I don't know why I can't remember the term. It's not reflecting, but I can't even picture the word. I'm a visual learner, and usually I can close my eyes and look up and think of the word, but I can't think of the word. But anyway, so this not the proper way to respond, because you have to realize and understand, or I have to realize and understand, that these patients are not mentally in their right mind, and their right mind sometimes is psych. They're dealing with issues. So you could be coming from a good place, but once again, as I spoke about the countertransference, you have to be careful. There's a thin line of crossing that patient provider relationship. And that was one of them. And that was totally my fault, because, well, at the time I didn't know that the correct response is to repeat what the patient says. And, and that's it. So that was a very interesting, significant patient interaction I had. I could go on and on. I got a little juice container thrown at me and hit my lip just last week. Inside of my mouth was bleeding. But this is a 5-minute video, so I'll talk about that hopefully in the future. But I was excited that this was a topic so that I could share that experience, and hopefully I'll be able to experience in a future video.